diabetes is a major problem in Singapore, and I think it's important to start young, whether it's in terms of physical activity or teaching the children to eat healthily. And when I actually came upon this fooya game, I was really very, very excited about it, because I think there are games out there, but games that are backed by research, and actually you don't see many of them. Yeah. So to me, fooya was really exciting, and I kind of experimented with it myself. I played with it. I got my kids to play with it, and it was interesting because when I got my kids to play with it, I didn't tell them it's a nutrition game. They figured out themselves, and they kind of knew how to play with the game, and at the end of playing they said, oh, that's a nutrition game. And I mean, to me, I think it's really, I mean, schools, they do teach children about how to make healthy food choices, but it's done in a classroom kind of setting. They have sort of quizzes online to test how much they know, but it's a one-off quiz. And whether it really, that kind of teaching or the kind of learning actually is sustainable is a big question to me. And it's not really fun, because the kids find this kind of teaching or this kind of instruction is like, it's just another class. And I think kids these days really like to play with games, and if we can actually engage them and teach them these healthy eating habits through games, I think it would be interesting to see if actually the kind of effects can be more long lasting. And so
that's fantastic. So as far as the emphasis on early childhood nutrition and health, from your vantage point of expertise and insights in terms of what you're seeing happening in Singapore, and of course the project that we're kind of exploring, is there kind of like things that are suggesting that this is an important area for in terms of children's health and disease prevention and things like that?
Yeah, definitely, because I think it's in the last 1 year we've seen a lot of emphasis, especially from the Health Promotion Board, trying to encourage healthy eating behaviors, greater levels of physical activities for the population, because we realize that diabetes is actually a very important threat for the country. So a lot of investments will go into fighting this disease. Why don't we sort of prevent people from getting into that stage whereby they might become diabetic? And we should do it when the kids are young. Because there's also research showing that if the kids don't eat healthily when they're young, most likely they would also not eat healthily when they're older.
Right. Yeah, no, that's fantastic. And as far as innovation and where NUS sees, I guess, this intersection between technology and kind of digital ways to achieve this objective, what are your kind of closing thoughts in terms of?
I think we have, in our own research, tried to look at how we can use games to engage kids more, and I think this is definitely something that we think would be very interesting to explore. Because as I said, this generation of children, they actually, you don't have to teach them how to use the phone or how to play the games. They just pick it up, and like I was telling you with my own kids, I tested the game. I didn't teach them how to use it. I just said this is the account. In terms of education, we are also looking at using online platforms for the students to actually be able to do learning outside of the classroom and do learning on their own. So when I thought of this idea of using games for children was because I know that in schools, again from my experience with my own kids, they have all these e-learning modules. And I actually thought, why can't we teach them these skills using a more fun method, using an online platform, rather than to have them go to a classroom and sit for 30 minutes or 40 minutes, where the teacher will go through like, okay, this is what you should eat, but this is what you should not eat. To them, I think this might become like traditional classes, and they might not be that receptive to it. So actually the idea of using games have been something that we've been working on and thinking
Awesome.
about how we can do that. So like I say, when I looked at fooya, it was like excellent, rather than developing the game from scratch, we could actually look at how we can use these games more effectively as a possibly a digital vaccine, a way in which we can build a more sustainable self-regulatory behavior for kids, in terms of choosing healthy food choices.